Hi, and welcome to my channel, Together We Can Ottawa, an initiative I did to reach out to the community and to spread a positive outcome. We broadcast on our social media platforms, Facebook, YouTube, Instagram, so please follow us on these platforms. Coming to a new country can be hard, but you are not alone. Some immigrants do experience barriers to accessing healthcare at the system provider level, at an individual level. So bridging this gap in newcomer healthcare requires the efforts of both newcomers themselves and the healthcare providers. Tonight, in this session, we will be talking about health services for the Ottawa newcomers. Tonight, we are joined by Sifan Rahman from Ottawa Newcomer Healthcare Center. Good evening, Sifan. Thank you for being our guest tonight.
Good evening. Oh, it's a pleasure. Thank you for having me.
So, Ottawa is a lovely city, and we welcome people from all over the world. Making a new home in Ottawa can be exciting, but it's also can be difficult. So we are trying to provide access to guidance about the healthcare system here in Ottawa and to make sure that the newcomers stay healthy. So as a start, Sifan, can you introduce yourself for the audience?
Sure, yeah. My name is Sifan Rahman, and I've been working within the community health center world for a while. I've had different jobs at different community health centers. And at the Ottawa Newcomer Health Center, I've been there since 2012 as a coordinator first, now as a manager. And today, throughout our discussions, I'll be giving you a bit of a description of what we do and who we provide services to.
Okay, so as a start, like community health centers, what are they, and like who can access them, and what type of services that they provide?
Yeah, sure. If we can go on the...
I think we have an echo. Do you have a cell phone next to you or something open?
No, I'll turn it off. But we can go to my slides.
Yeah.
And I have, yes, and then that's where I'll get right into what community health centers do initially.
Okay.
So if you go to the next slide, just in terms of an overview, I'll start off with what community health centers are, because not a lot of people in our communities, even my family and friends, do not know what they do and what they are. And then I'll talk about Ottawa Newcomer Health Center. So if we go to the next slide, community health centers use basically this model. So the model of health and well-being focuses on the fact that we want to serve the community, but we want to ensure their health and well-being. And what does health and well-being mean? It doesn't just mean their medical and physical health, but also mental health, any social aspects. So a community health center touches on all aspects of a person's life. And I think that's what makes us unique and different. And if you go on to the next slide, I'll say a few things about the first community health center. There's community health centers across the globe, actually. So lots of different countries have community health centers, and they're a little bit different in terms of what they do. But basically in Canada, we have similarities. The first one in Canada was in Winnipeg. It was established in 1926. In Ontario, we have the largest number of community health centers. Across Canada, Ontario has the highest, it's over 100. Basically, what all of the CHCs have are interprofessional team-based care, meaning we have physicians, we have nurse practitioners, nurses, but we also have mental health care providers, social workers, dietitians, foot care nurses, like a whole bunch of allied healthcare that are all in the same building. And I think that also makes it quite unique, because individuals can come and every care that they're getting, all the services that they're getting are in one place, and it's very customized to what their needs are. And it addresses not only their physical health, like I said, but if you need, for example, support with finding income support, finding employment, homework clubs for students, for kids. There's prenatal care courses for parents and parent groups. So it's a wide variety of programs and services that a person can access. So from cradle to grave, basically, is what we call it. And so programs for all ages. And one of the main focuses on within community health centers is our focus on equity and social justice. So if you see in 2012, there was a huge cut for federal health insurance for refugees. And that was a huge advocacy efforts. And a lot of it was led by community health centers in Ottawa too. So it's about enabling equitable access and equal access for all individuals in a community, that regardless of what status you have in Canada, what age group, so it's community health centers are usually at the forefront when it comes to advocacy. I can touch on a little bit more. The next slide is pretty much the same thing. We focus on prevention. Community health centers believe that prevention is better than cure. And I know a lot of other cultures in the world have that motto as well. And so that's what they're focused on. And again, focused on community and individuals first. A lot of the programs that we have, we look at the challenges that communities face. So for example, I work closely with newcomers, and some of the challenges are language barriers or access to services, knowing about the services. And so when we developed our programs, we looked at the challenges, but we partnered with community members who also serve newcomers and develop solutions. So it's basically very much focused on the community, focused on the challenges, and the solutions are reflective of what other people are facing and very much centered and around the client experience. The next slide talks about basically what CHCs do. And again, I said CHCs put people first, and it's customized to the needs. And when we're looking at the model as a whole, it's been proved to be very cost effective with high impact. So the model that it is, so it includes a lot of different health professionals and different healthcare providers within one team, and the way they're salaried, the way they offer the services within one-stop shop. It's studies have shown it to be very cost effective and impactful. I can, so that kind of covers what community health centers do. The next slide talks about the ones that are in Ottawa. So I can go a little bit into that. Ottawa currently has 6 community health centers. There are community resource centers as well. So Tariq, if you want to put the link up for the coalition. Coalition of Community Health Centers within Ottawa, Community Health and Resource Centers. We'll show you. If you go to that site, there is a section where you can find your CHRC. So you can put in your address, then you'll be able to see what community health center or what community resource center is within your geographical area. Most of the community health and resource centers serve a geographical area, and there should be one at wherever you're located. You should have one close to you. Community health centers are different for community resource centers. Community health centers have a medical clinic, basically, but community resource centers are very similar. We'll have lots of services just like community health centers, but they just won't have the primary care clinic. That's the only difference. But resources are very much similar. You can get services there as well. And so I would encourage anybody to go, regardless of whether you've been, in Ottawa for a long time. I'm sure you'll find services that are suitable to you. Other than most of the programs within a community health center serve a specific geographical area, but there are programs that are regional. So those regional programs are can be accessed by anybody living across the Champlain region. So not every CHC will have a regional program, and they differ. So Somerset West Community Health Center is the one that hosts the Ottawa Newcomer Health Center, and that is one program that is regional across all of Ottawa and surrounding regions, and we're the only one that serves refugees and immigrants within the CHCs, like the only regional program, but all community health centers do provide services to refugees and immigrants as well. Some of the services that are very common across all CHCs, like I said, the primary healthcare clinic, mental health support in some capacity, child and youth programming, programming for seniors, and then some have specialized services that are unique to that CHC, but overall, you'll find this similar model across all CHCs. So then I'll talk about my program. So Ottawa Newcomer Health Center, as I mentioned, is hosted by Somerset West Community Health Center, and it was first just a small clinic serving government-assisted refugees, but now we have 4 different programs serving, refugees and immigrants of all statuses, but also somebody could be here for 20 years and we could be providing services to them depending on their needs. The next slide talks about what our aims are. So like I said, within the Ottawa Newcomer Health Center, we believe in providing access to everybody. So we work towards enabling access for our population that we serve, reducing barriers. That could mean advocacy. That could mean developing programs such as our interpretation program to reduce the language barrier, for example, or providing in-person support, but also virtual services so that we reduce the barrier of related to transportation. So that's our aim. We provide coordinated care, meaning that when we provide services within our center, we also work with other settlement agencies or other allied health professionals across the center, but outside of the center, so that the person receiving care gets the care that is coordinated, so it's not fragmented and they're not having to work through and navigate the system. We do a lot of the navigation for them. And the things that we take pride in and we offer are education. We know that a lot of people, like Tariq said, when you come to a new country, it's very difficult to know what is out there, what kind of services that they have access to, what the rights and responsibilities are for individuals. So education, we heavily take time to provide education to our clients.
And we give them the correct resources and to know exactly where to reach out to.
That's right, yes. So resources such as whether it could be information that they do not know. So where do you get your health OHIP card? How do you apply for it? Where can I find free, prenatal courses because I don't have health insurance, so I can't get somewhere. So it can vary, and we get questions through our website. We get questions, people just call us for questions, and we take pride in taking the time to offer them answers, whether they become our clients or not. So that's something that we do. We refer them to services, whether it's specialist care or other services, and I already mentioned advocacy. The next slide talks about specifically what the 4 regional programs that we have. So we have a medical clinic, and because of our capacity and our size, we are currently providing full medical screening for any refugees that are arriving to the country. So these are government-sponsored refugees, privately sponsored refugees, refugee claimants. So when they come to the country, we do a full screening for them, and then we connect them to ongoing primary care provider in the community. So we help them find family doctors. We have a multicultural health navigator program. Now anybody can access that. So this is basically for newcomers, but we've seen clients who've been here for 20 years and still don't have a family doctor and needed support navigating the system. So multicultural health navigators are there. They provide services in 9 different languages and can help you kind of go through challenges that you're having accessing services, or let's say you're somebody's newly diagnosed with a chronic illness and they do not know where to even start, how to get resources, how to get connected to support groups. Our navigators can help with that. We do have a mental health services, which offers, this is a bit unique than other mental health services in the city, in that we don't really have a time limit for our clients, because we've realized a lot of our clients are in fact newcomers or refugees who have gone through traumatic experiences such as war, torture, trauma, kidnapping. And so we realized they can't just they can't become well with short-term counseling or 20 sessions or 12 sessions. We need sometimes to work with them and provide services to them for 2 or 3 years. So it's very tailored to what the clients need. And we serve individuals with moderate to severe mental health challenges. And finally, our interpretation services also is available for any programs out there, any services that serve newcomers and need to provide interpretation. So we're working on providing the support for clients as well, so that clients can request it. But at this moment, it's only for organizations that are seeking to provide interpretation to their clients.
Sifan, like around how many languages for
interpretation
they are dealing with?
Yes. We can provide services in over 250 languages.
Great.
However, in person, we have right now about 50 interpreters that can provide interpretation. We also have over-the-phone interpretation. So for some of the rare languages that we don't have interpreters, we do have over-the-phone services that people can connect with.
So language is not a barrier for getting these services?
No, not at all. Within our center,
exactly.
Not at all. Some of our clients need services outside of our center, and then we made sure that we use interpreters, or we send our interpreters there. And we train our interpreters in-house, but the standards are the same as anybody getting trained across the province. So they're high standards. They do have to get tested. All of our interpreters get language tested and trained over 70 hours in class, and then do a medical terminology test online and training online. And then they get certified interpretation services. They're also insured. So a lot of interpreters may not be insured who are working in the city, but these interpreters are insured. So if there's any misinterpretation that happens during an appointment, they are covered under our errors and omissions coverage. And the last slide talks about any changes that we've made during COVID. But if you have any questions before that, I can answer regarding our services.
Just like I'm thinking, like after we finish this, we might go through the website, just like an overview, to share it with the audience also, to have a look on it.
Sure.
And yeah, and so it's like, as you said, like what is being tailored now for the services during the COVID-19?
Mm-hmm. So in March, we never really shut down because we are deemed essential services. And so what we had to do, though, we did, initially we stopped providing in-person services because that was the legislation across the province. But soon after, we did again start in person. But when we first stopped, we implemented virtual care. So virtual care means a few things. It could mean services over the phone. It could mean services through video. And the platforms we use are platforms that are developed and used within the healthcare sector. So they're confidential and secure. But again, because a lot of the services do not really, or the platforms are only in English and French, we have to be creative for our client and for our demographics that we serve. So sometimes we may use things like WhatsApp or Zoom or something that is more easily accessible by our clients, and the language barrier isn't there and it's an easy link. So technology definitely we saw as an issue in at the Ottawa Newcomer Health Center, because not everybody has the devices that are needed. So when we did turn to virtual services, most of it was over the phone, but some definitely over video. So we changed to that, and we found that a lot of our clients did appreciate not having to come in for appointments. So that was good. We do active screening for anybody that's coming into the clinic. So that's asking questions, and then also being screened by our providers. We've staggered our appointments so that not everybody's coming in at the same time. We never really had a walk-in option, but even now we're very strict on that in terms of who's coming in. We encourage everybody to call in first. Our health navigators used to do home visits a lot. Now that's on pause, but they are still meeting clients in the community in a safe distance. All of us are wearing masks when we're inside the clinic, and when we especially can't maintain 6 feet distance, but also when we're outside and meeting clients in the community. We've modified our services a bit, like I said, in terms of hours. We used to have evening clinics. Now we don't. I mean, we don't really need to anymore. The flow of traffic isn't as much. And because we're doing phone services, that kind of helps meeting clients outside of the work 9 to 5 hours anyways. And so we're continuing to do that. Increased cleaning. I mean, as a clinic, you're always cleaning anyways and keeping this place sanitized, but now we're doing that a bit more in terms of when clients are coming, sitting in our waiting area, we're making sure that that's cleaned every time somebody leaves. Also high surface areas, we're cleaning a little bit more. We're encouraging everybody obviously to wash their hands and sanitize, employees as well, but also our clients when they're coming in. And within the center, everybody's getting more training about how to take, because all of us didn't used to all wear PPEs, wearing a mask, take off a mask. So training on how to take it off, how to put it on, when to sanitize your hands, how to really properly wash your hands, all of that. We've had to change some policies to implement these in terms of sick leave. So a lot of us within the community health center, we're so passionate and dedicated a little sometimes, and that's across all sectors. You're a little sick, but you can make it, so you end up going to work. But now everybody's making sure and encouraging that if you're even a little sick, even if you can't, then you can come to work, just for the sake of everybody's safety. If you're sick, stay home. That is like this strong message that we're sending to all employees. So we have enabled all of our employees to work from home as well. So set them up with devices, and that way they're able to continue to be efficient if they think they can still work. Yeah.
Yeah, that's great. That's great. And like it's the same as the mask concept. We are putting masks to protect ourselves and protect others.
Mm-hmm.
So I just wanna share the website just to go through it, just like an overview. We'll start with the community health resource center. So I will share that page, just an overview for people. That it's easy to. Okay, and it is shared. Yeah. So this is the website. We have, I think, two languages, English and French.
Yeah.
Simple, easy. Just like if you want to know exactly where is the nearest location near you, you just find your nearest and you just add whatever postal code you are in, and it will give you the nearest center near to you.
Mm-hmm.
And I think the hours are updated, or they need to call.
I think ours, most part, should be updated, but once you click on the specific CHCs, they will definitely be updated there on their specific pages.
Yeah, great. Okay, so and the link will take you to that specific center.
Mm-hmm.
Great. Just will go back. So, and here we have the programs and services. You can check which category you want. Women, seniors, primary healthcare. So it's like easy to navigate. Simple.
You can also,
I can also what season?
Sorry, no, you can also find, if you're looking for even employment within community health and resource centers.
Yeah, I saw this.
Yeah, to that.
So there's volunteer opportunities and there's employment opportunities. Great. And for the other website, just I'm going to share that. Okay, so this is the other website, which is Ottawa Newcomer Health Center, sorry. So also straightforward, easy. You have several languages, which is great.
That's the key thing. Yeah, it is a Google plugin, so you'll get Google Translate, but it's better than nothing.
Which is perfect. Like it will make it easy for them to navigate the website.
Yeah.
So here we can see the interpretation services, and I see it's like a coalition. Yes, supported by a coalition of programs.
We have a lot of partners.
And so also for people who are interested in pursuing a professional interpreter job, so you can apply also through their website. Great. So that's very, very nice to know, and we share the website with you. You can see them on the bottom of this live broadcast. So Sifan, so what is your general key things that you want to share with the community tonight?
So the general thing is community health centers serve a broad population. They're very popular once you get to know them. People really enjoy getting all of the services in one stop, but people just aren't aware of them. We are also mandated to serve anybody without insurance. So if you know somebody who's, let's say, an international student, right now they're not going to class, for example, and they have health insurance, they can go to a community health center. The only exception would be that we don't see visitors, but sometimes there might be in a situation that is difficult. So they can always try to go to a community health center and see what kind of services they can offer. At least what they can walk away is information for other free services. And so that's another thing is community health centers, all of the services are free. Whether it's a drop-in or a group or a registered program, it's free services because we focus on serving some of the most vulnerable populations in our community. But that's not to say that others can't access services. So I encourage you to check it out. At least go to the website. If not, go and check out what a community health center does. And within even Ottawa Newcomer Health Center specifically, through our website, you have an option. If you have any questions at all, you can just post a question, contact us through there, and somebody will get back to you. If you need resources, we can share that with you as well. So just drop us a line and we can get you connected. I think, Tariq, you're on mute.
Yeah, I am back. So thank you very much, Sifan, for the great session and for the great job that you are doing in the Ottawa Newcomer project. So it was a pleasure having you as a guest tonight. Thank you for joining us.
Thank you so much. And you're doing a wonderful job by bringing more information to the community. So keep up the great work. Thank you.
Thank you very much. Have a good night.
Take care. Bye.
Thank you. So, as a healthcare services is an important topic, I will be providing more guidance sessions about the healthcare system here in Canada in general and in Ottawa in specific in our upcoming broadcasts. So as a gentle reminder, I'm always would like to remind you to keep physical distance and to wear a face covering if physical distancing is a challenge for you. Don't forget to wash your hands frequently and avoid touching your eyes, nose, and mouth. Okay, gonna this. Yeah. So as we are coming into this, I would like to thank Ottawa for watching tonight. Stay tuned for our upcoming sessions and follow us on our social media platforms. We are on Facebook, YouTube, Instagram, and Twitter. So if you liked our podcast tonight, please like it, follow it, and share it. And you can also watch our previous broadcasts there. Stay safe, stay healthy, and good night.